Good afternoon. For your consideration, Diamante driver, age 12, dead for lack of dental care. Poor oral health can have morbid outcomes. Further health implications are steadily becoming known as more research is being done. Also for your consideration, U.S. Supreme Court, February 21st, 2015, rules against North Carolina Board of Dentistry. To summarize, dentists can make your teeth sparkling white, but they cannot decide who else can. February 6, 2015, Commission on Dental Accreditation adopts dental therapy standards, approved August 2015. These things are creating a shockwave throughout the dental community. It's changing the landscape. And what we do know, because dental care is important, is that we simply need more dental care at affordable prices and means for the most vulnerable of our population to receive. So what is happening among the states? Growing integrated health delivery systems that are creating pressures on health professionals impose scope of practice limitations placed on auxiliary and allied dental practice professionals. There's a demand now for full scope of training with greater levels of interdependence and independence and service complexity. So what do we have today? We have new emerging models of dental providers, advanced dental hygiene practitioners, dental therapists, extended function dental assistants, etc., with purpose to extend the dental capacity of dental practices to serve patients with less cost and more efficiency. I look at it from this direction as a dentist. I noticed when my 12-year-old daughter started her orthodontics treatments in my orthodontist office, that the orthodontist would walk to each of the service operatories as his assistants were busily putting bands and braces on patients. And I noticed how he checked each and every one of them. However, by having an extended workforce, that orthodontist was able to be more efficient, more effective. And therefore, to this day, orthodontist remains the #1 dental profession specialty as far as income and efficiencies. So what's wrong with that rolling out to the entire general dental population? Why can't general dentists take advantage of the same opportunities? So what we have today is new workforce models that exist at a time in which we can actually see them and use them. For example, we see progress taking place among the states as far as direct dental care access for prevention with dental hygienists. As you can see, in 2008, 28 states had a provision of direct access to hygienists. In 2011, 34 states. In 2016, we now have 38 states with a level of direct access to dental hygiene care. And now as we see the momentum is building also in the area of dental therapy. We have the state of Alaska that started with the dental hat, or DHATs, or dental health aid therapists. And from there, we see Minnesota, now Maine and Vermont has joined the group. Other states, as you can see in the orange, are considering taking the same steps. We also have tribes in Washington and Oregon that has already moved in that direction. So these are steps that are already beginning to happen. So what does it look like? Well, I tell you this. From the dentist perspective, it looks as if there's a lot of things budding out of dentistry. For example, we see all these different professions here in different circles. We have dental assistants, EFTAs, dental hygienists, community dental health coordinators, dental therapists, hygienists, dentures, dental technicians. What does that mean? Well, one thing I can say for certain, the sum is greater than the individual because it takes a team. Dentists need more hands to meet the needs with less cost. So what other factors are affecting the dental horizon? Well, #1, telehealth. We're seeing more and more technology come to play that allows dentists to supervise a team outside of the dental office. In other words, to create capacity, we call it spoken hub type of theory, where the extended dental workforce can be in one location and the dentist can lead the team from another location and therefore be able to coordinate care. So that is the future of dentistry. So for your consideration, it's time to have all hands on deck. Let's get it done. Thank you.